Good day to all of us. We are the group 2 and we are going to present a case study about electrolyte potassium. Physiological functions of potassium. Potassium is one of the most important minerals in the body, cellular and electrical function. It helps regulate fluid balance, muscle contractions, and nerve signals. A high potassium diet may help reduce blood pressure and water retention. It also protects against stroke and prevent osteoporosis and kidney stones. Potassium also helps your nerves to function and muscles to contract. It helps your heartbeats stay regular. Not only that, but potassium also helps more nutrients into cells and waste products out of cells. A diet rich in potassium helps to offset some of sodium's harmful effects on blood pressure.
Looking at the patient's vital signs and laboratory results, it shows that the patient has heart irregularities and has a low potassium serum level. The normal serum potassium levels range from 3.5 to 5 milliequivalent per liter in the blood. The patient has a potassium serum level of 2.7 milliequivalent per liter, and it appears to have a condition called hypokalemia. Hypokalemia is a metabolic imbalance characterized by extremely low potassium levels in the blood. Due to vomiting and having diarrhea for 3 consecutive days, too much potassium is leaving through the patient's digestive tract, which causes hypokalemia. Moreover, the medications that the patient is currently taking for his heart failure perhaps affected the level of his potassium level in his body. Because the patient's potassium serum level is low, he is experiencing fatigue, muscle ache, weakness, muscle cramps, nausea,
Nagre-record ka,
vomiting,
mente.
and diarrhea, which are the symptoms for hypokalemia.
These are the causes of the electrolyte imbalance. We have four: potassium depletion through certain medications, heart, kidney, and liver problems, severe vomiting, and age. So why? Why are these considered as the cause of electrolyte imbalance? Under potassium depletion through certain medications, the most common cause is excessive potassium loss in urine due to prescription medications that increase
Hinaan
urination.
mo, ante.
It is
Nagre-record naman.
also known as water
Hinaan
pills or
mo.
diuretics such as furosemide, Dexogen, and aspirin. Some of these types of medications are often prescribed for people who have high blood pressure or high heart disease. The sudden downfall of your potassium level causes the symptoms that the patient is experiencing. Potassium is a mineral your body needs to work normally, and it helps the muscle to move, cells to get the nutrients they need, and nerves to send their signals. Moreover, it has a vital role for the cells in your heart. The second one, we have heart, kidney, and liver problems. And here we have congestive heart failure, and certain diseases affecting the kidneys or liver can cause fluids to accumulate in your body, which dilutes the potassium in your body and lowers the overall level. The third one, we have severe vomiting. When a person experiences severe vomiting, this causes your body to lose electrolytes such as sodium and potassium, and it also increases ADH levels. Vomiting, diarrhea, or both can also result in excessive potassium loss from digestive tract. Vomiting leads to hypokalemia via a complex pathogenesis, and Gastric fluid itself contains little potassium, approximately 10 milliequivalent per liter. Lastly, we have the age. Older adults may have more contributing factors for hypokalemia, which includes age-related changes, taking certain medication, and a greater likelihood of developing a chronic disease that alters the body's potassium and even sodium balance.
So let's move on to the diagnostic test and result. On the left side of the PowerPoint, we can see the vital signs and laboratory results of the client or patient. So the patient's temperature is 97.8 degree Fahrenheit or 36.6 degrees Celsius. His blood pressure is 115 over 65 millimeters of mercury supine and 106 over 58 millimeters of mercury when sitting and 92 over 54 millimeters of mercury when standing. His heart rate is 112 beats per minute and his respiratory rate is 20. So his laboratory results in serum sodium is 140 milliequivalent per liter, which is normal because the normal level is 135 to
Ano?
145 milliequivalents per
Di pa kami
liter.
tapos.
In serum potassium, 2.7 milliequivalents per liter, which is low because the normal level is 3.6 to 5.2. If you have a result below 3.6, you have a low potassium level or hypokalemia. If you have 5.2 above, you have a high potassium level or hyperkalemia. In his blood glucose, he has 80 milligrams per deciliter, which is normal, and in his serum bun or blood urea nitrogen is 30 milligrams per deciliter, which is high. And in his serum creatinine is 1.3 milligrams per deciliter is also high. And lastly, in his digoxin level is 2.3 nanograms per milliliter, which is also high.
To conclude, potassium is a mineral and an electrolyte. It helps your muscles work, including the muscles that control your heartbeat and breathing, as it comes from the food we eat. As we observe in the case on us, a client suffering from extreme fatigue, muscle spasms or aches, weakness, and severe cramping in the through this, and he fell also being ill, including having constipation or diarrhea, nausea, and vomiting. Furthermore, in this case, he has a sign of potassium deficiency or hypokalemia, wherein this is a rare in people who eats balanced diets, then taking too much potassium supplements, prolonged exercise, usage of cocaine, potassium for conserving diuretics, and more. Hypokalemia is usually diagnosed with a blood test, but doctor many may also order an electrocardiogram for the heart and an arterial blood gas test to measure pH levels in our body. For medical interventions, um, it should increase the intake of potassium hydrochloride if needed to replace the electrolytes that had been lost and increase. it. The potassium hydrochloride is used as a medication for treating and preventing low blood potassium or the hypokalemia. It is a given by slow injection into a vein or by a mouth. Potassium acetate is preferred agent in patients with hypokalemia and metabolic acidosis. Potassium acetate can use through injection. This is to prevent and correct hypokalemia in patients with restricted or oral intake. It is also used as an additive for preparing specific intravenous fluid formulas when the needs of the patient cannot be met by standard electrolyte or nutrient solutions. Hypokalemia is treated with oral or intravenous potassium. To prevent cardiac conduction, store-bought, the intravenous calcium is administered to patients with hyperkalemic electrocardiography changes. Maintenance of serum sodium occurs by a product of matching the intake of sodium, potassium, water with the corresponding glasses. Hyponatremia describes a serum sodium concentration which is lower than normal. It is most commonly a result of excess water diluting the serum sodium levels in the body, such as sin and congestive heart failure. Correction for hyponatremia, when required, is usually done in secondary care. The treatment must be gradually to avoid any cerebral demyelination, which can fatal. By the using of oral oral rehydration salts would also help by replacing salts in water that the body loses when the patient have dehydration caused by diarrhea and vomiting.
So moving on to the drug therapy applied. As you can see, there are many medication that the patient is currently taking that can cure his diseases, which is the metoprolol, digoxin, and lisinopril for his congestive heart failure. Metoprolol can improve left ventricular function and symptoms of congestive heart failure. Digoxin helps the heart pumps more efficiently. It strengthened also the force of the heart muscles contractions that help to restore a normal, steady heart rhythm and improve blood circulation. Lisinopril blocks a substance in the body that can cause the blood vessels to tighten, in which it relaxes the blood vessels of the patient. On the other hand, the patient is also taking aspirin effectively to reduce all the manifestation of his rheumatic fever disease. Next one is the furosemide that works by acting on the kidney to increase the flow of urine that can help also to lower his blood pressure. And lastly, the potassium chloride that helps to prevent or to treat low blood levels of potassium.
Normal serum potassium levels range from 3.5 to 5 milliequivalent per liter in the blood. Normal daily intake of potassium is 70 to 100 milliequivalent per liter and requires the kidneys to remove the same amount each day. If more is removed, the body's total potassium store will be decreased. As a result, hypokalemia occurs. In managing this kind of condition, the patient must replace the potassium loss. The patient may replace his potassium loss orally or intravenously. Consumption of foods high in potassium may be the first option in replacing potassium of the patient. Bananas, apricots, oranges, and tomatoes are high in potassium content. Moreover, the patient can get more potassium by taking supplements. Since potassium is excreted in the kidney, blood tests that monitor kidney function may be ordered to predict and prevent potassium levels from rising too high. If the patient's situation is severe, that his low potassium level causes irregular heart rhythms, potassium might be given as an intravenous solution. When potassium needs to be given intravenously, it must be given slowly. Potassium is irritating to the vein and is usually administered at a maximal rate of 10 milliequivalent per hour. Moreover, infusing potassium too quickly can cause heart irritation and promote potentially dangerous rhythms such as ventricular tachycardia.
For principal correlation, we have potassium. Potassium, it is an alkali metal element that can be found in the period 4 of the periodic table. Potassium atoms have 19 electrons and 19 protons, with one valence electron in the outer shell of an atomic weight of 39.10. It is also considered chemically similar to sodium, which is another alkali metal above it on the periodic table. Potassium metal is soft and white with a silver luster, has a low melting point, and is a good conductor of heat and electricity. It also has a very low density and is the second least dense metal after lithium. It is so light that it can float in water. Chemically, potassium is a very active metal. It reacts violently when coming into contact with water, producing heat and hydrogen gas. It also reacts with many other elements and substances such as oxygen, acid, sulfur, fluorine, and nitrogen. There are three isotopes of potassium that occur naturally, the potassium 39, 40, and 41. The majority, which is 93% of potassium found in nature, is potassium 39. It is an electrolyte that counteracts the effect of sodium, helping to maintain consistent blood pressure. Potassium is also important for maintaining the balance of acids and bases in the body. Last, we have the potassium chloride. Potassium chloride, it is a binary salt with the combination of metal, which is potassium, and the non-metal, which is chlorine. The ions from potassium chloride derive from a strong acid, which is hydrogen chloride, and a strong base, which is potassium hydroxide. Therefore, neither ion will affect the acidity of the solution. So, potassium chloride is a neutral salt. Potassium chloride is highly soluble in water and a variety of polar solvents, and insoluble in many organic solvents. As potassium chloride dissolves in water, the ions are hydrated. Polar water molecules attracted by the charges on the potassium and chlorine ions. It is used to prevent or to treat low blood levels in potassium, which is hypokalemia, as a result of a prolonged illness with diarrhea or vomiting. And this is the end of our presentation. Thank you for listening.